health issue that really only now. Or if it was good. We'll do it together. But if we want to improve public health, we have to tackle violence against children. And we were very pleased that in Bogota, out of these more than 110 pledges, several were done by ministries of health. In Jordan, for example, there was a big commitment to improve services of all kinds to victims of violence. In Pakistan as well. In Brazil, there was a strong commitment to improve parenting programs, which are so essential. In Dominica as well, the whole series of programs where health has a role was pledged towards. So we have solid pledges, but my plea here to all ministries of health in the room and those not here is to really scale up the health sector's response. It is not an issue just for social services. It is not an issue just for education. It is not an issue just for justice. It's an issue for all of them, plus ministries of health. And that's why we're really happy to bring back this topic here. We at WHO stand ready, of course, to continue our support. We have capacity building programs for workers in ministries of health to help them detect and respond to violence against children. We have support available for data collection, for parenting programs, and together with our partners, agencies in the system, looking very much forward to scale up with all of you. Thank you so much.
Thank you, Etienne. Etienne covers many subjects: social determinants of health, commercial, road safety, drowning, but he's very passionate on this issue of violence against children. So we're very grateful to have a director that's covering so many topics, but that supports this topic so much. We're going to move on to hear from a survivor of violence who speaks about the important role of the health sector. The video should now work. An introduction of Janet Agouti, who's part of the BRAVE movement, which was set up in Bogota, as Alejandra said. It's a new movement focused on child sexual violence, but they're very strong in many countries around the world today. And thank you to Janet, who I believe is also online, but this is a pre-record.
Thank you very much for the opportunity. Ladies and gentlemen, ministers, colleagues, and friends, my name is Agouti Janet. I'm from Uganda. Today, I speak to you not just as an advocate, not just as a founder of WHA platform or a member of BRAVE movement, but as a survivor of childhood sexual violence. Being sexually abused at only 8 years, I did not dare to speak or to share with anybody for over 17 years. I lived in silence, carrying trauma that shaped how I saw myself and the world. But eventually, I broke that silence, and now I hope others do the same. My story is not unique. Around the world, countless children suffer violence in silence, in shame, and without help. What saved me and what continues to save others is access to compassionate, timely, and trauma-informed public health care. From 2018, the WHA platform was founded till now. I have witnessed countless survivors, majority of whom are children below 16, struggling to know where to go for support. Many a times, when they go to the health facility, there is no trauma-informed personnel to care for them, or even medication to prevent long-term effects such as HIV or pregnancy for those at a child age-bearing group, leaving many vulnerable and helpless. The most recent case I was involved in was of a very brilliant 13-year-old girl who was taken advantage of by her head teacher. Knowing what to do, because of the training we held in her school previously, she went the next day to the government health facility nearest to her. She was told to wait as the trained personnel was not yet in office. The medical doctor then came 3 hours later, but had to first attend to others. She was running out of time. When her turn came, they did not have some medication and was asked to go to the next drug shop or to come back the next day. She didn't have any money to buy the drugs, so she had to come back the next day, but unfortunately, it was already too late for her. She is currently 3 months pregnant, meaning she had to drop out of school. That is potentially another life destroyed. This is why public health is not just part of response. It is a front line of protection, of healing, and of justice. Health workers are often the first people survivors meet after violence. They are the witnesses to pain, but also potential gatekeepers of recovery. Yet too often, they are undertrained, underfunded, and unsupported, many of whom are demotivated. When they are not equipped to identify or to respond to abuse, survivors are re-traumatized, neglected, or simply turned away. Public health is more than just immediate medical treatment. It encompasses ongoing mental health support, sexual and reproductive health services, and community awareness initiatives that reduce stigma and promote healing. Public health services must be safe spaces. Survivors should not have to prove their pain. They should find care, not questions, dignity, and not doubt. At WHA, we have seen how transformative integrated public health services can be when medical support, mental health care, and community advocacy comes together. At Brave Movement, we have witnessed that long-term effects of sexual abuse is preventable. Actually, sexual abuse itself is preventable, and there is proof in the work each and every member in the Brave Movement does. My organization has held trauma-informed training to first-hand respondents, mostly health officials, worked with survivors and engaged communities to end stigma and stop the silence. This has helped us see tremendous reduction in teenage pregnancies in my district, which was among those in the highest level, with the highest level of teenage pregnancies and registered high rates of school dropout among the girl child. But this is just a drop in the water in the grounds that is not enough to create change. We need systematic change. We need governments and ministers to make survivors visible in their health budgets and policies. We need healthcare systems that do not just patch wounds, but understand trauma, that listen, and that believe. Let me be clear. Public health is not a luxury for survivors. It is a lifeline. So today I call on each of you to ensure that survivors are not an afterthought in your ministries, but a priority. Let the health care system be the first place where healing begins, not where the pain continues. Again, health is not just physical well-being. It's mental, it's emotional, and it reflects in our social lives as well. Let's move from pain to power, from silence to systems that actually care, because every child out there deserves safety, and every survivor deserves to heal. Thank you very much. Have a great day.
Thank you to Janet, if you're online. I see a lot of names. I think you're online. Maybe you could put your video on if you are. In the meanwhile, we'll hand over to our colleagues from the Philippines. I mean, you have them. Oh. You have such a beautiful name. I mean, Mary Ann Palermo Maestro. That's like a star.
That's how I wish.
The Undersecretary of Health of the Philippines, over to you. Thank you very much.
Your Excellency, Madam Ambassador, Honorable Minister, my fellow delegates, colleagues in protection of children, good afternoon. The Philippines recognizes the fundamental right of every child to grow in a safe and nurturing environment, free from all forms of violence. Strengthening child protection policies to raise public awareness about the harmful effects of violence, the Philippines is actively working to create a society where children can thrive without fear. This dedication is reflected in the country's alignment with international conventions on child rights and its ongoing efforts to build capacity within communities and institutions to prevent and respond to violence against children. It speaks to a future where every young person can grow and thrive in a safe, nurturing environment, shielded from physical, emotional, sexual neglect, and exploitation. This ideal requires a multifaceted approach encompassing strengthened legal frameworks, robust social support systems, proactive community engagement, and widespread education to challenge cultural norms perpetuating violence. Prevention and elimination of violence in the community include raising awareness, enhancing knowledge and skills for preventing violence and protecting oneself, and influencing social and cultural norms. Recognition, reporting, recording, referring, and case management of violence against children is being done through a quality and comprehensive medical and psychosocial team approach, including mental health, interventions and services, and local government unit response and cooperation whenever necessary to ensure a holistic response. The Philippine Department of Health has institutionalized this multi-sectoral approach through our women and child protection units. All hospitals, by the way, are required to have this in the Philippines. As of 2024, 104 women and children protection units nationwide were established. They are hospital-based units that provide medical, psychological, legal, and social services under one roof. Trained physicians, social workers, mental health professionals, and police officers work together to also address non-medical problems through a socialized team by coordinating with other government agencies and non-government organizations for a more efficient delivery of services. Additional platforms and mechanisms where victims can access services of the WCPU through remote consultations are established. Tele-WCPU at the local or community level, which was initiated by a partner NGO during the height of the pandemic. So we have trained hundreds of health professionals in trauma-informed multidisciplinary case management, grounded in the 4 Rs: recognize, report, record, and refer. These efforts are supported by the Women and Children Protection Management Information System. This is a digital platform that enables real-time tracking, case monitoring, and resource targeting. So beyond the hospital walls, we are working at the community level at this point. So through our Adolescent Health and Development Program, we empower youth with life skills and facilitate access to adolescent-friendly services. We are rolling out gender-based violence toolkits, behavior change campaigns such as WHA Be Wise, meaning wise WHA, and linking WCPUs to community mental health services for reintegration and continuity of care. Moreover, legal frameworks had been instituted to ensure that children are protected, namely the Republic Act 11188 of 2018, or the Special Protection of Children in Situations of Armed Conflict Act. Children are affected by armed conflict as both victims and perpetrators, often facing violence, displacement, and the loss of education and basic rights. Furthermore, the Republic Act 11930 of 2022, or an act punishing online sexual abuse of exploitation of children, otherwise known as anti-online sexual abuse or exploitation of children, and Anti-Child Sexual Abuse or Exploitation Materials Act, guarantees the fundamental rights of every child from all forms of neglect, cruelty, and other conditions prejudicial to their development, and protect every child from all forms of abuse or exploitation, whether committed with or without the use of ICT. The DOH continues to prioritize work in strengthening prevention, protection, and response mechanism across the lifespan, beginning in early childhood. The government is building a survivor-centered, trauma-informed, and systems-based approach to tackle this issue at multiple levels, the national, regional, and of course, the local levels. These efforts reflect lessons learned, coordinated multidisciplinary services enhance trust and outcomes. Digital systems improve accountability, and partnerships across health, education, social welfare, and justice sectors are essential. Yet we acknowledge that we cannot do this alone. We join the global call for coordinated, health-led protection systems that institutionalize safeguarding across all levels of health system, secure sustainable financing for survivor services, develop evidence-based clinical guidelines for trauma recovery, and mainstream child protection within the universal health coverage frameworks. At the heart of the DOH efforts is the acknowledgement that robust financial resources are essential for these programs to succeed. Funding enables the establishment of shelters, counseling services, and educational initiatives, which can be attained through convergence of programs among relevant government agencies. We should be able to support training for professionals such as teachers, healthcare providers, and law enforcement officers to identify and address instances of violence effectively. Finally, we urge all countries to see the health sector not merely as a responder, but as a proactive partner in prevention, standing at the front line of care, compassion, and protection. Together, let us build a future where every child is free from violence and has the opportunity to thrive. Thank you.
Thank you, Dr. Palermo Maestro. I mean, I've been to the Philippines. I've seen your child protection work. It's incredible. So we're really flattered that you're here with us and leading the way around the world, really. From one star to another, we have Brianna Marinas, who's one of the young people who is very involved in Bogota. She's in Manila, and she agreed. There she is. Maybe you can just spotlight her so we can see her a bit better. She's been driving the youth movement and is organizing single-handedly so much for youth around the world to end violence against children. Over to you, Brianna.
Okay. Hi, everyone. Can everyone hear me?
Yeah, we can hear you.
Okay, great. Anyway, thank you so much for inviting me here today. I am a bit nervous, but I will try to speak a bit slow. It's so nice to see you all, and I hope I have the chance to see you all again for the next ministerial conference, wherever it will be. But I'm here today to just share a quick update of what's been happening with the global youth-led movement on ending violence against children since we launched it in November last month. So I actually have a lot of updates, but I'll try to keep them short. So since the Global Ministerial Conference last November, we've been keeping up momentum by creating different partnerships with different organizations and mobilizing a lot of young people across the region. So for example, my colleagues John Keane from Kenya and Nobu from Zimbabwe are working on the movement in Africa, and they've been connected with the African Children's Summit and the Children's Delegation, and as well as the national governments to establish partnerships. So on my end, I've been focusing these past few months really on efforts within East Asia and the Pacific. So partnering organizations like Childlight, Kiduno Thilfi, Save the Children, We Protect, and even the Tech Coalition to work on advocacy efforts for young advocates and survivors in the region, specifically around the Safer Internet Day and addressing online harms. So currently, on behalf of the movement, I'm also leading a really big regional youth consultation with 20 other youth leaders from 11 different youth-led and child-serving organizations around the region and Timor-Leste. So if I can just mention who our partners are for this regional consultation. They're Child Rights Coalition Asia, UNICEF, Plan International, ASEAN Youth Voices for Change, World Vision, Child Fund, Save the Children, SOS Children's Villages, Terdo OMS, and ECPAT. I mention all of these organizations specifically because I want to show that collaboration really is possible, and I'm really hoping hoping that moving forward from this point, we can have all of our different organizations and governments work together. So the regional youth consultation will actually feed into two really important regional plans of action. So number one is the ASEAN Regional Plan of Action on the Elimination of Violence Against Children that is currently being led by the ASEAN Commission of Women and Children. So we actually just came back from Jakarta last week for the regional children's consultation, and we also have a regional youth consultation. And in addition to that, we'll also have a regional youth statement on ending violence against children. And one of the stuff that I really wanted to include in this is actually asking all young people across ASEAN what specific pledges from the conference they want their governments and ASEAN in general to work on. So that's something that you guys can look forward to in the next couple of months. And then now focusing on the Philippines, like my home country, I have been really involved with two specific efforts and progress here in the Philippines. I'm very happy to share with you all. So as you know, like the Philippines had many pledges. I'm very happy about that. But one of them is specifically on parenting and caregiver support. So I've been working with Masayang Pamilya Organization Inc., or Parenting for Lifelong Health here in the Philippines. And we just finished one parenting program module for a parenting program with teens with the ASRH, or Adolescent Sexual and Reproductive Health. And our programs really try to focus on teen engagement, because a lot of the things that we also focus on in the movement is making sure that not just parents and caregivers know how to break the cycles of violence, but that us as young people, when we become parents in the future or even caregivers, we know what to do to break the cycles of violence. And right now, because unfortunately the rates of teen pregnancy have been skyrocketing in the Philippines, especially for young people aged 10 to 14, we're just about to finish our first ever parenting program for teen parents of that age range and their babies 0 to 2. And so this is a really, really big, and I would say like very exciting effort that I'm very excited that will be hopefully disseminated across the country. And the last thing I want to share about that I'm also very excited for is this year, fingers crossed, the Philippines will be hosting the first ever national youth-led summit on ending violence against children for young people aged 15 to 24. And so this summit specifically builds on the Philippines' commitment to prioritize child participation and community engagement. And the goal of the summit is really to focus on uniting and also amplifying youth efforts and child protection across the region, so that we as the next generation actually know and have the tools and expertise to end the cycles of violence. So I believe that like this focus on children and young people has really been the missing core link that all of you guys have had over the past few years. So I'm very excited for this, and I'm very excited for all the collaborations. And with that, of course, it can't just be talk, right? So I'm very happy to say that for this summit, I have the support of the Department of Social Welfare and Development and the Council for the Welfare of Children in the Philippines, along with a lot of different CSOs and even schools across the country. And if I can leave all of you with anything, is that I hope that you can continue to support us and other young people in the movement, continue to partner with us and prioritize us, and also know that even if it's only been 6 months since the ministerial, we've been right here and we've been moving. And so like whether anything happens or not, we are here and driving the force. So yeah, thank you so much, everyone, and thank you for letting me be here today.
Very much, Brianna. I mean, Brianna leaves messages of like 15 gigas on my phone pretty much on a daily basis with everything she does. So if anybody in this room thinks they're not able to do something, look what she does on her own. I mean, I know she has a lot of partners behind you. You've created a movement, but really it's a lot of leadership and drive. Yourself, you've spoken about it, are a survivor of violence, and that is an additional drive, and you protect your siblings and you help other young people. So really thank you for everything that you do, Brianna. And a real example for all of us to continue doing more and more and more, because we can do more. With that, we will move on to Kenya. Dr. Uma Oluga, Principal Secretary of State of the Government of Kenya. Thank you very much for joining us, and over to you.
Thank you very much. Maybe I'll start by just clarifying that Dr. Sukani Matendechero, Deputy Director General for Health,
Sorry for that.
Principal Secretary. Of course, there are very many competing interests, so he's been caught up a bit, but he was hoping that maybe he would be join us. But nonetheless, I will give some reflections from the Ministry of Health in Kenya around this very important subject of violence against children, and probably also just be able to look at how it relates to, very intimately relates to the element of corporal punishment that we are all concerned about. So just so that we can be able to get some little context, in the experience of Kenya, we have realized that the violence against children is quite widespread, because we are seeing a very high unacceptable prevalence of about 50%, with a slightly higher occurrence among the male children. We are also seeing that among the various forms of violence, the most common is physical violence, followed by sexual violence among against our children, and then of course there's also quite a bit of emotional violence which has been recorded. So as a country, we have actually been very intentional in terms of being able, and also as a part of the, the take homes that we were able to pick from the ministerial meeting. And even before, we have put in place several measures just to be able to mitigate this problem. One of the things we have noticed is that the public health approach is extremely important in this objective. However, even as we appreciate that, then we are also cognizant of the fact that this is a multi-sectoral effort. And so we really have to make sure that we are employing the whole of government approach, whole of society approach, so that among the various key agencies and departments, we have been able to create a platform, a committee, a national health sector gender-based violence technical working group that involves, has representation from the Directorate of Children's Services. It also has representation from the judiciary, as well as the Ministry of Education. Now, in Kenya, we have a devolved system of government where some of the functions, like, for example, the children's services are devolved. So we have some functions being, exercised at the national level, while others are being implemented at the county level. So we have a national government and the county governments. And for these particular devolved functions, then we have a very clear, description of what each level of government does. So, for example, when it comes to the Directorate of Children's Services, then we expect the national level really to take care of formulation of programs, dissemination of policies, establishment and management of institutions, and so on. While at the county level, then we expect that the county governments will really make sure that issues around rescue and placement are taken care of, issues around psychological support, home visits and the generation of welfare reports are also not left behind. So this multi-sectoral approach has really helped us to be able to achieve quite a number of objectives. But as a health sector, then we have really championed the following interventions, which are just very quickly, just mentioned, so that we can all be able to appreciate in the interest of time. So number one, we have come up with a very effective way of building capacity within our health workers. This is something that we have done between 2022 and 2024. We were able to train over 3,000 health workers across the country, just to make sure that they are well, they have capacity for identification, management, and the referral of violence against children cases. Using both face-to-face, training, as well as online training. So we have reached more than 3,000. Number two, we have also specifically put in a very big effort to integrate violence against children the screening of violence against children into our public health programs like maternal, child, and adolescent health programs, which is really helping us to be able to pick out some of these cases that we are talking about. Number three, we have also really moved in terms of integrating the violence against children indicators, in our health information system. So we have a Kenya Health Information System, which now we are able to disaggregate the information and the data that we are receiving. By age, we are able to actually analyze it in terms of sex, in terms of type of violence, just as I had mentioned in the beginning. The fourth issue, we have developed a national guideline, which is on provision of psychosocial support, for the children survivors of violence, and also in this guideline, it actually helps us to be able to work out our training for the trainers across the country. I think one of the speakers who came before me pointed out the importance of having, communication, the whole spectrum around information, education, communication, and that's one of the areas that we have really come in. In Kenya, we have this group of people this cadre of individuals that we call community health promoters, and we have over 107,000 of them, distributed across the country. So when you work out the statistics, you find that for every 500 people in the community, we have one community health promoter. And among these people, plus also other people in the community, we have a group of very important people called community-owned resource persons, who together with the community health promoters across the country, we have been able to now develop these packages, the information, education, and communication packages, which we are using now to train these cops as well as the community health promoters who interact with the community members quite a bit. And this has proved to be a very robust platform for us to be able to share information within the community. And then finally, we have been able to review our national guideline for prevention and management of gender-based violence and the standard operating procedures manual, because gender-based violence we have seen cutting across even among the children. It's a very key area that we have to pay attention to. So in the interest of time, I just want to request that I pause at that point and to thank you very much, especially the organizers, for putting together this very important discussion. Thank you very much.
Thank you very much from our colleagues from Kenya. Uganda didn't show up, unfortunately, but we've had gave us a bit more time for both the Philippines and Kenya. So thank you very much for all the wonderful work you're doing. We're going to briefly show the video and then hear from the CSO perspective.
It started when I was 13.
When I was 6 or 7.
It was my stepdad.
Our youth group leader.
My cousin.
I was a child.
At no point did anyone say, "Are you okay? Let me help you."
It wasn't safe to go outside. Home wasn't exactly the place to be either.
It used to beat me with a phone book, and I know some people will think, well, what the hell was you using a phone book for? Well, the reason why I used a phone book, because it was heavy, and the type of bruising it would leave wouldn't be the same as being punched or kicked.
All I wanted was to learn.
Instead, they took me and trapped me with all these other girls.
And for every lascivious things that I refused to do, they would starve you. Like, literally starve you.
I couldn't tell anyone at school either.
I thought I would get into trouble.
Finally, someone spoke up.
A girl a bit older than me. She saved us all.
But then what?
This constant fear, it never leaves you.
There is no getting over it. Only through. Only 3.
Half of all children are victims of violence. Violence that damages the childhoods of today and societies of tomorrow.
We are the first generation with the knowledge and the power to ensure every child is protected.
The power to end violence is in our hands.
Powerful video that was shown at the start of the ministerial conference in Bogota, which is also available on our website. In fact, the website will be relaunched. The new website will be launched end of this week, and we'll share it very widely. With that, I'm going to hand over to Florane, who's representing many civil society organizations. Over to you.
Thank you very much, and thanks for the organizers for inviting us, and also for the leadership. I think it's really important that you lead the effort and continue, after the Bogota conference, especially in this current context, which I will go to in a minute. So I'm from Terrorism International Federation, but today I represent several civil society organizations from the CSO Forum and the Joining Forces Alliance. And we already heard powerful voices from, survivors and young people, very energetic. I'm not going to be like this. I'm too old. But I wanted also to start by sharing a quote from a child, because I think it's important that we hear those voices. So it's a 14-year-old boy from Lesotho who's talking about the new child and gender protection unit set up in the region, in his region. So I don't have to sit in the big police station anymore, where everyone goes and where we are exposed to those who cause harm to us. Now there's a space just for us children where we can report child protection issues, get help, and speak freely about what happened. I think it's really important to hear, survivors, young people, and children to put a human face to violence against children. We talk about numbers, systems, institutions, but they are lives of millions of children that have the right to protection and need safe spaces to report abuse, seek justice, and heal. So speakers have highlighted that they've been notable progress across countries, including led by the health sector. And the Bogota have played a big role in, accelerating and creating a momentum. And it's important, to celebrate those gains and build on them. However, in the current context, and this was mentioned, it's important to acknowledge concerning global trends, including, significant budget cuts and the prioritization of child protection. And these challenges threaten to undermine some of the achievement and remind us that we cannot, afford to become complacent. And we really need to build on the effort. So as civil society working across, development and humanitarian context. So we, of course, call on, all actors, governments, donors, and multilateral partners to keep prioritizing child protection as both foundational and life-saving. And, several colleagues said that it has implication across sectors. And it's really important to see this multi-dimensional aspect. So the funding must be sustained, expanded, and it needs to be integrated into broader investment and action in health, education, gender equality, climate, social protection, etc. And in the current context, events like this, but also, the regional actions, national action are really important that, EVAC, countries and actors committed to EVAC speak up, lead peer engagement, and also support the EVAC investment case. So beyond, funding and also the prioritization, there's two elements that I have very, limited time. So I'll be very short that I wanted to highlight that are really critical that some of you mentioned, is to ensure the accountability to and participation of children. It's important that their right to participate safely and meaningfully is must be upheld, and with mechanism of follow-up and accountability So it's really important. Some of you mentioned it as part of some of your activities. And also related question to accountability is the importance to invest in gender and age disaggregated data system. So, we can drive evidence-based programming and policy. So to conclude, so child protection is not optional. So we all, know that, and it's a cornerstone of, national development, humanitarian action, and global security. And CSO like us, bring legitimacy, accountability, and the direct connection to children and community. And we are ready to partner with all committed actors to deliver the promises made at Bogota, much, beyond, and maybe support what the colleagues from UNICEF was saying, the child protection revolution. Thank you.
Oh, I'll hand over to Etienne for closing.
Thanks so much, Sabine. Thanks, colleagues. I think between the people online, the people in the room, we had more than 100 people joining this event. And as we all know, there are many competing events at the same time. And if you decided to join this one, it is because you care. So thank you for that. In the world we live in, which is not in a very good place, as you just said, caring is important. I think we've made a very strong case that violence against children is a mega public health issue that deserves more attention, that needs multi-sectoral collaboration, that needs the public health sector to play its role. And we've heard from several speakers that the health sector in some countries is doing a lot, but in others not yet, and more can be done. Bogota was a great success, but for Bogota to be the success, it will be measured in the implementation of the pledges that happened. The conference was vibrant and exciting, but if we don't implement the promises that were made, it will not be the event we were hoping. And so let's collaborate, continue to collaborate. I want to thank my colleagues, by the way, also, because they really make a point of making sure that we have monthly webinars, that we at every occasion repeat the importance of implementing these pledges. So we stand ready in WHO, with civil society, with UNICEF, and with many others to continue working with you. But in the end, it is the governments who have the biggest role to play, and we look forward to support you in that. Thank you so much. I hope to see you next year. Maybe before we close, I should have mentioned that this morning we had another side event focused on corporal punishment with Kenya, Costa Rica, with support from Colombia, Finland, and Thailand. Thank you, Alejandra. Taking the lead, and that's another result of Bogota, taking the lead on an upcoming World Health Assembly resolution for next year on banning corporal punishment. And any member state in this room would be very welcome to join this movement. So please feel free to reach out to either any of these 4 or 5 member states who will be pushing this through next year. Thank you so much. There's still a lot of food for those who want.
Thank you very much. No, I think we're meeting now, right? Yes. Briefly, I have a meeting. Yeah, so we have a meeting.